is going to be determining your axis, and axis is a reflection of the mean vector of ventricular polarization. What does that mean? In not so complicated terms, your heart is a muscle. It squeezes, and it has an electrical signal and a muscular signal of the response of the electrical signal. And what happens when you squeeze is that's going to let some energy out. That energy is going to be reflected by a mean vector of where the electricity happens. Now, it doesn't just happen straight down the heart. It happens a little bit more towards the left than the right of the heart. The right ventricle is much thinner because it's obviously not pumping to the same amount of pressure. So it's just like any muscle. It's trained based on what it has to pump to. So a pulmonary resistance is, in the 20 to 40 systolic millimeters of mercury, compared to the typical blood pressure you'd have on the left side of the heart of your afterload of 120 to 140, let's say, for your systolic. So you have a much bigger left ventricle that is going to have a little bit more of the electrical axis shifting towards that left side. So as such, your vector will tend to be towards the left a little bit of midline. And as an example of that, here is a little flashback to geometry. Here's a unit circle, or not, I shouldn't say geometry. Here's a flashback to trig. The basic concept here is you have an X and a Y axis, and I'm going to draw on this a little bit here. The vertical here and the horizontal here, they intersect and they give us some vital information. And down here you'll see it says norm. This is the normal axis. This is where your mean electrical vector should end up. And so that's such to say that your heart is going to generate your mean electrical gradient going in that direction, that arrow showing towards the 3 o'clock to 6 o'clock position. Now, where do we find lead 2? Oh, look at that. Lead 2 is right about the 5 o'clock position. Just so happens that is a very pretty lead that we like to do bedside telemetry in, and that's the reason, because it's upright and rounded in our P, QRS, and T in the normal patient. Now, I say normal because your axis being normal will cause that for all of the things that are in there. Now, it can be in different directions that will cause that to shift. So over here, let's say you're on that rightward side of the screen here, but that's actually the patient's left. Let's say your mean electrical axis is this direction, and it's going towards the 1 to 3 o'clock on the screen. So that would be, so there's a 0 degrees here, and this is minus 90 degrees. So this band here, this band is a left axis deviation. So the pendulum has swung towards the patient's left. If you imagine a pendulum at the rear of this, up here, let's say, it swings straight down here in a normal axis, and it has swung over towards the left. So it's a left axis deviation. Likewise, the right axis deviation would be. Atrial axes are not that useful, especially if you have patients that are in atrial fibrillation or atrial flutter or some other atrial ectopy. I don't really care what the mean vector of the atria is, because it doesn't really tell me where my ventricle is going, and our 12 lead is really designed more for looking at our ventricle, but it does show a lot of your atria depending on which lead, so don't get lost in my comments and say, that's not true, you can see the atria. Well, of course you can, but the point of your mean vector here, we're more worried about the electrical flow of the ventricles, because that's where we have all of that mean juice. The atria causes most of the little P wave, right? I'm curious about the QRS. I want to know where all the juice is going, because there's good things that happen and bad things that happen when they're off the sides here. So let's just give an example of that. You have some normal and abnormal things here to consider. So normal axis should be between that 0 to 90, so that 3 o'clock to the 6 o'clock position on the circle I just showed you, and you have a little bit of leeway in addition to that 3 o'clock. It's maybe more like 2 o'clock, and then down to, instead of 6 o'clock, more like 7 o'clock. So you have a little bit of a window that's a little bit larger than 90 degrees. Keep in mind, though, that just because it's deviated doesn't mean it's bad. So we talk about two different concepts here. There's when you have bad axis deviation, that would be a pathologic axis deviation. Now, there's also situations where you might just have an axis deviation, and it's called physiologic, not pathologic. Physiologic means that, yeah, it's there, it exists, but don't really care. It's expected, or it's not a concern. A perfect example of this is if you have a pregnant woman in her third trimester, I can almost guarantee you that you're going to have a left axis deviation. Why? Because you have a baby pushing up, and that baby's pushing up on the diaphragm, and it's pushing up on the mediastinum, and it's going to cause the apex of the heart to be translated to the left a little bit, and as such, your mean vector of electricity is mechanically sent a little bit leftward. Is there anything wrong with the heart? No. But that said, that is one of those findings that you would expect in that situation. It doesn't mean it's wrong. It's just, it is what it is. So we call that a physiologic axis deviation. Now, as a general rule, we do get excited with these axis deviations if they're brand new. Just like any picture you take over time, it's all about trending. It's saying, what was it yesterday? Now what is it today? Or 1 month ago or a year ago? An EKG is going to give you the ability to say, did anything big happen? And axis deviation is kind of like the electrical system in your house getting inspected. If everything is looking good, that should be about the same as the last time. If that vastly changed, that's kind of a concern. It may require you to take a look and see what caused it to change. Did you have some issues in the basement? Did you get some water? Was there some flood damage? Or who knows? Something changed in your foundation. Something changed in how everything works. Either you did an addition or something happened. You had a subtraction, so to speak, in your heart muscle. Perhaps you had an MI, and all of a sudden you don't have a lot of electricity that's going through that scar tissue, and now you've shifted your axis away from it. Or maybe you have a more complex issue going on, like a bundle branch block, and there's some damage that's caused a shift. So the point being, axis deviation is a subtle indicator, but it's also a very easy to include finding. And in fact, it's simply electrical. It's not that this something you have to do a whole lot of work to decide. This is an electrical vector that's going to be demarcated on the top of every EKG. When you look at the very bottom of the little descriptor that talks about your different indices of your PR and your QRS length, it'll say PRT axes usually, and you'll see that R axis is really what we care about.